everybody. My name is Keely Spring. I'm a licensed marriage and family therapist in the state of California. And today I have with me Veronika, and I will turn it over to her to introduce herself in just a second. We've actually known each other for a little while now through a professional organization where we met. But Veronika actually has a really interesting niche, and I thought the audience might really want to hear about it. So without further ado, I'll turn it over to you to introduce yourself, Veronika, and just share a little bit about what that niche is and the work that you do and kind of what populations you work with.
Yeah, great. I'm excited to be here. Thank you, Keely, for organizing this. And so I'm a marriage family therapist, and I work in San Francisco, but my specialty is working with ketamine. So I'm a ketamine-assisted psychotherapist. I Prior to that, when we met, I had a private practice, and my focus was on the treatment of trauma. So I have a variety of trainings and modalities that I bring to support clients, including internal family systems, somatic experiencing, EMDR. And in 2016, kind of because of my interest in treatment of trauma and working with different modalities, and also my background and working with non-ordinary states of consciousness through holotropic breathwork, I became a therapist on the MDMA-assisted therapy clinical trials. And so started working with MDMA as assisted psychotherapy, and then kind of started with ketamine. So since 2017, I've been mostly doing ketamine-assisted psychotherapy. I still see few individual clients, but most of my work is with ketamine.
Mm-hmm.
And yeah, and just to add it, also through the years in the clinic where I work and which I co-founded, we also started a training program. So we also do training for therapists, and part of it is experiential training. So I facilitate these training retreats where therapists take the ketamine and kind of learn through self-experience, which I think is just a really important part of the work that I'm doing.
Mm-hmm. Yeah, I think the experiential is really a powerful kind of form of, in general, no matter the modality, is having that experience as a clinician, so you can understand kind of where somebody's coming at or coming from or experiencing in that moment is powerful for sure.
Yeah, I think, the big kind of idea there is to, shift the power dynamics to be more in this. There's always going to be that the therapist is holds the power as a therapist, but comes more to that egalitarian place, and that the client is really leading. So the therapist is following the client, and it's a non-pathologizing model, so that we are not looking at the diagnosis or what's wrong, but rather helping the person's kind of wholeness to come through. And so in that way, also, I think from kind of being in that role of a therapist or psychologist, and being kind of more, having like very strict boundaries, and not kind of sharing much about oneself, also creates, it's sometimes people feel like they're not as engaged in some way. And so the self-experience really kind of helps, I think, deepening the relationship, even if the therapist never shares about it with the client.
Mm-hmm.
Yeah.
So I do have a number of questions, but I think I want to kind of jump ahead than I normally do. We'll kind of dive back into your journey to get here. But since you've kind of brought up ketamine, could you, for anybody that might be listening, explain kind of the benefits of ketamine? What is it? If somebody has never heard of it before, could you share just a little bit about kind of what that is?
Yeah, so ketamine is a medication. It's a Schedule 3 medication that's been approved for a long time, actually for anesthesia. So it's classified as dissociative anesthetic. And early on, they started to notice the psychedelic effects of ketamine. And so it was when people are coming out of anesthesia, they were sharing these experiences they've had. And kind of when you think you're in a hospital, it's not a place to have psychedelic experience or diving into your personal history. So in the Western medical field, they called it the emergence phenomena and started using benzodiazepine to kind of create amnesia when people take ketamine or have ketamine for surgery. But then, it was interesting to psychologists and psychotherapists and psychiatrists. And so a lot of research began, and it has shown to have antidepressant effects, but also a lot of other potential benefits because it is an NMDA antagonist, which means that it kind of blocks the parts of the brain that kind of then that leads to the increase of glutamate in the brain. And glutamate is a neurotransmitter that is responsible for learning, for new learning, creating new connections in brain. So it increases neuroplasticity. And so the ways, how ketamine works is in these three different categories. And one is the neurobiochemical. So that's kind of when we look at the brain and, what happens and that I think like really correlates with that antidepressant effect. So there is quite a robust symptom reduction for people. But then it has in the lower doses kind of the psycholytic effect, which means mildly psychedelic effect. And it gives people a little bit more spaciousness from what they're struggling with. So from maybe the depression or the negative thoughts or beliefs about themselves. And so they can kind of step back and experience themselves without those. So really connecting to, maybe you could say their true self or their, part of themselves that does not carry those beliefs, which then it kind of allows the psychotherapy. And also it can help them go to past experiences that might be connected to their symptoms. So it could be past trauma so that we have access to memories that wouldn't come maybe otherwise in psychotherapy. So there is that psycholytic way how it works. And then last but not least is the psychedelic effect, where it's a very similar to classic psychedelics, like when you think about psilocybin mushrooms or LSD, that experiences of these non-ordinary expanded states of consciousness can be very similar with ketamine. And we could talk more about it, but there is kind of these different realms of consciousness where people can enter with the help of ketamine that then can lead to process that leads to shift and change and healing. And so that is ketamine, and it's most research is done in that medical paradigm. So in IV infusions, and now you also find therapists who work with IV clinics, and that's and so where I work is that psychological and transpersonal paradigm. But of course, clients are getting the benefit of the ketamine, of the medication. So it's a very interesting modality and exciting way of being able to support clients.
Mm-hmm. And so who is an ideal candidate for ketamine-assisted therapy?
So the variety of clients come. So there are people who are coming for treatment of depression, anxiety, trauma. Also, sometimes people come who have been for a long time in therapy and they feel stuck, like that, maybe they're not sure where to go, and there is something that the ketamine can help them deepen the process. So oftentimes or most of the time, I would say, I work with other therapists. So the client has a primary therapist, and then they come for a series of ketamine sessions, and sometimes 1 to 3, and sometimes 6 to 10. But at the same time, they're still seeing their therapist. So then I'm collaborating with the therapist they have, and there are other indications why people come. It can help with end of life anxiety. It can help with challenging medical procedures or illnesses or things that the transitions and changes in life that a person can have challenging time with. It has been used with people who struggle with OCD. It has been used for treatment of addictions, and I don't specialize in those areas. I have colleagues that work with me at Polaris and also outside of Polaris that I refer to when people come for those reasons. And so there is quite a variety of people who come. So a few years ago, most of the research and the recommendations was for people who struggle with depression. And but now the population of people who are coming for ketamine is much wider than that.
Mm-hmm. Mm-hmm. And you kind of mentioned this. It's 1 to 3 sessions, 6 to 10. Is there I'm assuming just kind of assessment that you assess kind of what the person might need and then kind of follow the protocols from there? Is that accurate
Yes.
or I don't know?
Yeah, it's a great question because that's what people want to know, and also when you're hearing about treatments, and the answer is not as simple because all the research that's been done with ketamine has been done most has been done with the IV infusions. And there is usually a protocol that people go for, 4 sessions, 6 sessions, 10 sessions. And what we know from this research that the symptom reduction happens for majority of the people by the 4th session, and that another part of the people who didn't respond will respond by the 6th session. So that there is this, kind of by the 6th session, most likely if ketamine is going to work for someone, they're going to have a symptom reduction. But that's when you're looking from that medical model. And I don't see that it completely translates to the way how I work because we are working with psychotherapy. So ketamine is really a catalyst for the process. So the therapeutic relationship, the material that emerges is what we are looking for. And of course, the symptom reduction is great. And the treatment plan is really individualized. So, I would recommend to anyone to do at least 3 sessions because it's especially if they, and if they've never worked with me, it's a lot to put pressure that everything will happen in 1 session. And people feel anxious, and that's natural when they're coming in, they don't know what it's going to be like. And so the first session is most of the time to really get to know each other and to understand the guiding principles of the work. And then by the 2nd and 3rd session, they're feeling more comfortable and diving deeper in. So I would say in average, people come for 10 sessions, but I have worked with people for 1 session and it was very helpful. And I've worked with people, for 1 session and they decided that it wasn't the way they wanted to go. And I worked with someone for, I think the most sessions I've done with a client was over several years. I worked with someone who struggled with severe depression, and we did 54 sessions. So, and it's the ketamine sessions, and there is also integration that happens in between. And so it's kind of interesting because like if your client came to me, they would see you weekly. And in addition, they would see me for ketamine session and then potentially integration session. So it's quite intensive time. And then, over time, they might, do the ketamine session with me and kind of they have the integration in the beginning and end of the session. And then they continue the process in the personal therapy.
Mm-hmm. And are the sessions with you, are they a typical kind of 50-minute session or are they a longer kind of process?
Yeah, so there's 3-hour sessions.
Yeah.
So they take 3 hours. And sometimes people need 2.5, sometimes they need to stay a little bit longer, but I would say average 3 hours. And I started working at the IV clinic and when I first started working with ketamine. And so there the sessions are usually like 60 minutes because the infusion is 45 minutes. And then the medication has to wash out from the body. So it was 60 minutes. And the approach I had was exactly the same that I had when I started working at Polaris, but the sessions were longer, and I could see and the duration of the medication is similar. The clients would go much deeper. There was more material that would come out, and it's kind of the psyche knew, like I think the unconscious knew there is 3 hours, there is enough time. And so when we were in that 60-minute session, there was like a way, like, oh, this would take longer, this is not going to come up. And so that's why I then started working and I work mostly with sublingual ketamine, and then in the clinic we work with intramuscular ketamine, which is like an injection to an arm. So with those two routes of administration, it's kind of easier to do these longer sessions, and that's what I do. That's the only way how I work.
Yeah. So it kind of leads me to, I'm curious, how did you get to this point? And what was your journey to becoming, a clinician and then specializing in this? You've hinted at a little bit, but I'd love to dig in a little bit more about it.
Yeah. So it's a long journey, and it started really early on. And so when I was 16, it was right after the a few years after the revolution happened, and I grew up in Czechoslovakia, and there was a transpersonal conference, and I somehow went there and saw a talk by Stanislav Grof. And Stanislav Grof was a Czechoslovakian psychiatrist who lived in the United States by that time, and he did a lot of research on LSD psychotherapy, and then developed the method of holotropic breathwork, which is a way of changing one's consciousness through breathing, music, and internal focus. And so in a way, like a similar setup or setting as we do in the ketamine sessions. And so I met him when I was 16 and was just really inspired by his approach to treatment, healing, humility. And he inspired me that I started studying psychology. So that's, how I went to psychology, and holotropic breathwork became a part of my personal healing and my personal therapy. So the couple decades, or at least one in the first decade, was most of my therapy was combination of holotropic breathwork and talk therapy, for my personal healing and process. And he was also the reason why I moved to San Francisco. So I from Czechoslovakia, or then Czech Republic, I lived in a couple other places, and I moved to California, and then went to CIS, which is a school in San Francisco where Stan also taught. And then, as I mentioned, became a psychotherapist, and really my path was guided through the clients that I met. So it never was that I had an idea, like I'm going to be a ketamine therapist or I'm going to be a trauma therapist. Like I was working with clients who came to me and then realized, like, in supervision, like where I was missing something, how could I help this client more? And then I went to EMDR training, and then I was like, okay, in the body. And then I went to somatic experiencing. And so, like these different ways kind of led to the path. And so, I applied to work with MAPS MAPS is the Multidisciplinary Association of Psychedelic Studies, the organization who sponsored the clinical trials for the treatment of PTSD with MDMA. And so I applied to work with them, I think in 2009, and I haven't heard from them until 2016. And then was, kind of surprised by getting an email, and was invited to be part of the kind of first cohort of therapists being trained for MDMA-assisted therapy. And it, was kind of life-changing for me. It was... I was able to bring everything I've learned so far and all the experiences with clients to that work. And then at the same time, it was very familiar to me because of the holotropic breath work. And then from there I worked on the study and continue to learn and deepen the practice and with my and then I was working at a ketamine clinic, as I mentioned, the IV infusion clinic, and developing ketamine-assisted psychotherapy program for the clinic. And from there, me and 4 other colleagues from the MAPS study decided to co-found a clinic called Polaris, which is the clinic where I work now. And that led to working with ketamine, and I studied with Dr. Raquel Bennett from the Kriya Institute, and then with Julian Andrews and Phil Wolfson at the Ketamine Training Center, and went through self-experiential trainings with working with ketamine. And it was several personal sessions that were also very impactful for me and for my healing. And so then I just continued to be curious about the healing potential of ketamine. And because of my history of working with trauma and because of the MDMA trials, we started working with trauma patients with ketamine. And so at that time, it was there wasn't a lot of research for trauma. It was almost not recommended. It was like a orange flag for someone with trauma, but all my clients were coming with trauma, and now it's quite different. So now it's much more common that people work with ketamine-assisted psychotherapy with ketamine. So that kind of led to this, and just continuing to learn and develop. And I so over the last 8 years, I've also been trained as a therapist for 5-MeO DMT clinical trials, and also have training as a psilocybin facilitator for Colorado. But most of my practice is ketamine-assisted psychotherapy, and as I mentioned, the training of clinicians.
Mm-hmm. And it probably goes unsaid, but I'll say it. These are in person, right? You're not doing virtual ketamine-assisted therapy.
So you would be surprised, but it is possible to do
Oh, really?
ketamine virtually.
Interesting.
But most of the work I do is in person.
Mm-hmm.
And I, enjoy it much more. And I think it's, there is the importance of the personal contact. And any client I work with, my preferred way is to have the first session in person at least, but most of them I do in person. And of course, all the trainings are in person. But in the pandemic, as all of us, we were faced with this question: what do we do? Do we do them virtually or not? And because so many people were deeply depressed, and that also who we started to work with then was the first responders, and it was nurses, emergency physicians, firefighters, and therapists who were supporting others and themselves didn't have enough support in the pandemic. And so we were, having conversations with all ketamine, group of us. I cannot say all, but probably 10 to 15 ketamine therapists in the Bay Area, and exploring the pros and cons of doing it virtually. And some of us moved forward and some didn't. And so we started at Polaris doing these online sessions and online groups. And we actually found out that for some people, it was a preferred way of taking ketamine, because they're in such a vulnerable kind of place sometimes, and they were in their bed and they didn't have to, after the session, get up and go. And when they were severely depressed, actually, it was easier for them in the beginning. And so then once they could come in person, many of them would come in person. But so, I still do some virtual sessions. And I just want to mention this because, there is a lot of now different ways that ketamine is being offered. And there are a lot of companies who mail ketamine to people to do at-home sessions alone. And they, kind of are somewhat monitored. And I think that is really important to be mindful and careful for, because there are risks and there is a possibility of having challenging experience, and it's more, it can be traumatizing when you're alone and don't have the proper support, where when it happens in therapy, when you have someone there, it can actually be transformative and helpful, so that but also sometimes clients who've seen me for some time, they might do a session alone as part of their treatment. So that is, but it's very different than when they receive ketamine by mail and do it at home. And that might be helpful and appropriate for some people. But it's, sometimes it gets kind of confusing, like what is what and what are we doing? And so I would say, 80% of my work is in person and then some virtual.
Mm-hmm. It's super interesting. One kind of last question I have about this is, you hear about it being used, especially here in the Bay Area, more recreationally. People use ketamine. I'm curious because my understanding with psilocybin, for example, is that it's not addictive. It doesn't have those kind of properties that typically we would see with addictive kind of properties. But is ketamine, addictive? Is there a risk or a concern that people who, do this would then become addicted to the ketamine?
Yeah, yeah. So there is not physiological addiction that has been shown that there would be physiological withdrawal effect, but there is definitely a psychological addiction potential because of kind of the dissociative aspect of it, and that kind of it supports somebody. So it's kind of a way of getting away from like looking at what's actually coming up for them. So it's like it could be used in the opposite goal than what we are doing in therapy. And the other really big risk is recreational use or misuse of ketamine is a cystitis, which is a bladder inflammation and could cause even a permanent bladder damage. And that's usually, seen with people who really misuse large amounts of ketamine over extended periods of time. And I do have concerns around the misuse of ketamine, especially with, these mail-in ketamine. And in the same time, it's such an important tool for healing that I would really hate to see if there was a change in that not being available. And so my concern is that, from some of the bad experiences that could lead to some changes in, scheduling of it or the requirements for working with it. So I think the education is so important, and the training of therapists. And what we see with our clients is that the relational context, like it being used in the psychotherapy, the relationship with the therapist, and then seeing the ketamine as the catalyst, as the third, in the therapy is oftentimes seen kind of as a sacred. And then there is this ceremonial aspect. And, when I say ceremonial, meaning like there are these steps in the set and setting, how the sessions are, how we relate to the ketamine, how we prepare, how we work with it, how we integrate. And so that it's a process, and that actually these three things prevent the misuse of ketamine. So now we've treated several thousand of patients, and there has been, less than a handful of clients who misused or who, taken it out of the agreed upon way. So I think there is a way to work with it without exposing people to a risk of wanting to misuse ketamine.
Yeah, fair. Thank you for speaking to that. I assume that would come up as people's question. I'm sure you hear that one a lot from people.
Yeah, and and there is like things also, still seeing a lot of misinformation on ketamine, and that there's some really challenging cases that it has been misused by the police, that there have been deaths, from people that happen with ketamine. And so there is a misuse of ketamine. And then there is misinformation, like the death of Matthew Perry that you probably heard of, that he, died in a hot tub with high dose of ketamine. And so, of course, and injected ketamine many times over the several days. And so it's not used in the prescribed way. So any medication we can abuse, if it's benzodiazepine or sleep medication, that,
Alcohol.
pain medication would not be safe. And then, being in a pool of water, and attended or unattended, but even more unattended, of course, it's a tragedy, but it's not because of ketamine.
Right. What you're talking about is really kind of setting that container and really kind of holding people in this kind of space that really kind of creates a safety and this ability to kind of go there and explore in this way that, without the ketamine might not be possible, and kind of redefine how they interact with emotional, different challenges, trauma, like you were saying, different things, right? But you're really creating that container and holding that space.
Yeah, to have a relational repair and greater access to the material
Mhm.
that we're going to work with, and supporting the neuroplasticity, because the highest increase of the neuroplasticity is in the first 2 days after the session. And so it's important what people do and how they, prepare and spend the time after the session. And it's like an opportunity to introduce new habits, make changes. And we see that, that people are able to do that throughout the treatment, which is encouraging. Yeah.
For sure. Which kind of leads me to my question. What do you like about therapy and the work that you do?
Yeah. It's it's like it's always evolving, that I am always learning, and that there is this mutual support of, I think, kind of becoming more truly ourselves, like making, connecting with our true self, like allowing the essence of the person to come through. And so, as we do that, I think we become more in integrity with ourselves, in our relationships, in how we care for others in the community, how we care about the planet. And so I feel, so grateful to be able to join people on this path
Mhm.
of healing and becoming more themselves, and how they want to be and how they want to have their lives. And I think there is this reciprocal thing that it kind of shows me where, I can do better, where I can grow. And so as I am working on myself, then I'm able to help people more. So there is something that it's always evolving. And I think that's my favorite thing about being a therapist.
Mm-hmm. Kind of blends into my next question. Are there things that surprise you about being a therapist still?
Yes, yeah, it's I think that's the beautiful thing about it, that we think we know, but we never know, so that there is always something that comes up that is like, oh, okay, I haven't been with this before, or, and so it's a like, I think what it is also the deeper we go in ourselves, and the more kind of space we can hold, there will be more things that are coming. And so I think in some way it could be infinite, that there is things that we have to allow ourselves to be surprised.
Mhm.
Because if we are in a place like, okay, I know, and I have this tool, and that's how we're gonna go, um, it will block the process. But also, for me, it would become kind of like, I think, boring and habitual, that like there is that way of like really being in the relationship together.
Mhm.
Yeah.
Uh, kind of to that end, I feel like you're kind of leading into all my questions, which is great. Is there anything that you wish people knew or understood about therapy and this kind of process?
Yeah, yeah. Um, Living in the Bay Area, I think it's still, there's, I think so many people I know are in therapy and see the value of therapy, but maybe still in even in Bay Area or other places, I think it's maybe not as still common that it can be really part of like that, that there are tools that we can use, like we can journal and we can do art, and there are a lot of online resources, more and more all the time. But sometimes there is a place where really we need to get support of the therapist that can help to ask the questions and provide support that we can move further, and that also we can um, there is something sacred and special about having that space for oneself to uh, beginning to really understand and know oneself. And so that the investment in therapy, I think, is in a way pays out much more, because it's allows to find greater freedom. And so I think I wish there was still more acceptance of therapy, and that it's not only that it's something wrong, that it can be that, something's right and we can go to therapy and also have personal growth, and that's the depathologizing model. And also, I think that sometimes when we don't have that's something that's really bothering us, that it's like an opportunity for going deeper and grow, so that therapy can support it.
Yeah, it's kind of allowing that space for things to come up that, might not come up if you're in crisis mode, right? If you're in trying to solve the problem mode, right? You don't go into those deeper, kind of darker places that might be there, just don't get enough airtime or, kind of ability to be seen.
Yeah, yeah, and the one thing which is, it's kind of a goes also with ketamine therapy, but as therapy is, it's like there is both, right? That there is these dark, challenging places and these beautiful places, and what is the role of awe and wonder in therapy, and that, like in especially in psychedelics, and with ketamine in this case, that people might have just really beautiful and easy session, and they might say like, oh, I'm not working hard, and this was waste of the session, but it's actually like allowing oneself to experience more joy and more connection, and that can also open new doorways. And and then sometimes you're with something that's really beautiful, and then suddenly something challenging or dark comes up, so there is kind of this balance that comes in the process. Yeah.
Yeah. I love that framing for sure. So thank you, Veronica, for kind of sharing. I think people will find that interesting about the ketamine. This is the part of the interview that I like to kind of get to know you just a little bit more. Are you open to answering some questions and sharing?
Yeah, let's see.
Okay. Sorry, Suri just wanted to join in on the conversation there. I don't know if you heard that. Suri was like, uh-huh, let me know. Okay, so first question, what is making you happy these days?
So I live in Marin, and I love taking walks and hikes, and so just the springtime and the warmth, and just that makes me happy. I have a dog. She's a poodle, kind of a mix, but looks mostly like a poodle. And she's with me all the time, so I love being with her. And these days it's kind of simple, being with friends, singing. I like to go to singing circles. Um, So those are kind of the things I enjoy.
Love it. Okay, next question. What's your favorite app? Doesn't have to be therapy related. It can be any app.
This is great. This is age revealing questions.
Hadn't thought of it that way, but maybe.
I honestly don't use so many apps. So I'm looking at my phone. What is there? Um, it's really I re like Spotify, I guess Spotify, that's where I go. Yeah, I
App?
listen to music and sing on Spotify.
Nice. Okay, beach or mountains?
Sorry, one more time.
Beach or mountains?
Okay. Beach.
Like Bay Area beach or tropical sunny beach?
Okay, tropical setting.
There.
Hawaii. That's my
Ideal beach.
dream that like once every, many years I go, but um yeah, tropical beach.
Okay, what's one thing that movies never get right?
Hmm. Hmm. This is I don't have an opinion. Like I don't think there is like something that comes up for me like that. I think one thing is, that maybe we don't always show the value of challenging experiences. That there is like a lot of focus on happiness and joy and overcoming, but really like looking at what is the growth and there are of course the movies that show that, but that um I think kind of create, what's mostly shown creates this idea that, challenging is bad. And so
Mhm.
the value of that.
Hmm. Okay, what's the best way to relax?
I think being in nature for me, and reconnecting, walking in the forest. If you can be barefoot on the ground, I think that's the best way that the earth can kind of help us
Hmm.
take the stress
Hmm.
away.
Yeah, super healing.
You could be singing on the walk and drinking some nice tea, and like you can amplify it.
For sure. Okay, do you have a dream trip location? You mentioned Hawaii earlier, but is there somewhere that you really want to go?
Um, it's not a new place, but I love going to Sedona. I love going to Mount Shasta. Um, I, I think I want to go to northern California coast. It's not a super exotic trip, but I, want to go there. Yeah.
Okay, what advice would you give your younger self?
Mhm. And trusting more, to trust more that um, um, leading with the heart instead of a mind. That I
Hmm.
think as my younger self, I try to always figure things out.
Mm.
And I think being in the heart and trusting if it's oneself, trusting universe, trusting life, that um, that's maybe faster way, easier way.
Than trying to think your way out of everything.
Yeah, then a mind is good for receiving and getting understanding, but gets over involved.
For sure. Okay, out of the four seasons, which one's the best?
Uh-huh. Summer.
Summer.
Yeah. I love summer. Yeah.
Okay. We have got three more questions here. So, first one, what would be the worst superhero power to have? It's a thinker, for sure.
I am not sure what it would be, but I would not personally want to feel everything that's going to happen. That there would be a way of wanting to prevent, harm and challenges and being is maybe not able to do all that. So
Hmm.
that would be challenging.
Sure. Yeah. The like knowing what was coming, basically, premonition kind of stuff.
Yeah, I think to some extent it can be helpful, but in some extreme way.
Not so much, for
AI speed way.
sure. Okay, what animal resonates for you? I see your little puppers there, but what animal resonates for you?
I love horses, and um, so I think it's horses, and then there is this is the poodle.
Okay, final question. When you look back at your life, what would you hope to be able to say about it?
Hmm. That I lived as much as I could in integrity and supported um, people to for growth and healing, so that made a difference in the world.
Mhm.
Yeah.
Yeah, that's beautiful. All right, thank you, Veronica. You are officially seen. You taking the time to talk with me and share about your niche and the work you do. And for anybody watching, I will include your information and how to get a hold of you below if they'd like to reach out for more information about the ketamine assisted therapy. Is there anything else you'd like to add before we hop off here?
Just gratitude to you for doing this, and thank you for all the work you're doing with your clients and in the world. So, um, yeah, great to have been here. Thank you.
Thank you, Veronica. Appreciate it.